Come on in.
Hi, Dr. Gwantwa.
Oh, hi, Fatma.
How are you?
I'm fine, thank you. Have a seat.
Thank you.
I haven't seen you in my office for a while.
I know, but it's a good thing. As you know, I'm here for another reason, not the same reason this time.
Oh, I see. So what can I help you with?
As you know, I have 2 young children. I love them very much, but wow, do they keep me busy caring for them? My husband wants to have more children, but I'm concerned about having another child. Not only do I have enough time to care for them, but I don't think our family has enough money for extra food, clothing. Also, we need to think about the medical and education costs that involve with having another child. I guess I'm worried about how difficult pregnancy could be at this time, and I'm thinking about what could be done to prevent that possibility.
Oh, I understand what you're saying, Fatma. Many women and men have the same concerns you do. You know, there are times in our lives when we welcome the possibility of becoming pregnant. At these times, most of it, we are ready to begin the long process of raising a child to adulthood and ready to take on the family, social and financial responsibilities with bringing another life into the world.
I see. Yes. I was ready for my first 2 children, but my kids are a lot of work. I'm happy to do what I need to care for them. My husband and I enjoying having the children. Now our family seems complete. And I'm not sure I'm ready for another child.
I see, Fatma. Family situations do change. Sometimes we just aren't ready or willing to take on additional responsibilities that comes with having a child. For example, we may not be married or in a stable relationship, or we may not have the money needed to raise a child. Maybe we just don't think we have the energy needed to care for another child. They do keep parents busy, don't they?
That's for sure.
Times are changing as well.
What do you mean by that?
Well, in the past, parents may have planned on having many children, so the children could take care of the parents in their old age. Life is different now. Now parents may choose to have fewer children, so they are more likely to get a good education and support their parents in that way.
Yes, we want our children to receive a good education, and we can afford to pay for their education if we have fewer children.
Another change is that fewer children are dying early in life, so nowadays parents are much more likely to have all their children surviving into adulthood. The improvement in medical care has been remarkable.
Yes, I have seen many improvements during my life.
That's right, Fatma. Another factor to think about with family planning is your own health. For example, I have some women patients who have various medical conditions such as diabetes or high blood pressure. These conditions can lead to increased risks to the life of the mother and the baby during pregnancy.
Yes, I can see how poor health could be a problem with pregnancy. I know some women can have serious problems with pregnancy.
Yeah, pregnancy and delivery is actually very serious condition that place a great deal of strain on the body. Sometimes women die during pregnancy or delivery, and the child is always at risk as well. While pregnancy is a medical condition that requires close monitoring by a healthcare provider, and the delivery process should also be in a health facility, so any problems can be dealt with immediately. Having a baby in the home has significant risks for the mother and the baby.
Well, I remember very well how I had problems with high blood pressure during my last pregnancy, and difficulty with delivery as well. I was glad I visited you during my pregnancy. Otherwise, I wouldn't even known about potential problems I faced. You probably saved my child's life and helping me through the difficult delivery.
You did have some difficulties, Fatma. I imagine that these concerns play a role in your thoughts about another pregnancy.
Yes, they do.
So, Fatma, how can I help you with your decision?
I know there are several ways to reduce the chances of becoming pregnant, but I'm not sure and a little confused about how well each of them works, what the problems are, and the risks are within the choices. Can you please teach me about the options for my husband and I?
Oh, sure, Fatma. Many women go through the same decision process. There are several options for preventing unwanted pregnancies. We call the decision and method for preventing pregnancy birth control. Another word for preventing pregnancy is contraception. Let's talk about some options for contraception. But first, I want to tell you how you become pregnant.
Doctor, I know how I become pregnant. I have become pregnant twice, and I have 2 children. After all, it happens during sexual intercourse, right?
You're right about that. But I want to tell you some medical details about how a baby is made that will help you better understand your options for preventing an unwanted pregnancy. You may know some of these, but I bet there are some new things you will learn.
Okay, Dr. Gonta, please explain to me.
Okay, first we need to talk about the parts of the human body involved in creating a baby. The man has some important parts required to make a baby. A man has 2 testicles. This picture is seen from a side point of view, so you can only see one here. But a man has 2 testicles that are located under the penis in a loose sac of skin called scrotum. The testicles are where the sperm are made. Sperms contain important genetic information about the father that will be present in the child. These testicles makes millions of sperms in a man, and they are stored until they are passed into a woman during sexual intercourse. These sperms have wiggly tails that help them to push forward as they are going towards the woman's egg. The penis, which is right here, is the part of the man used for urination, but also used for sexual intercourse. Millions of sperms pass through the penis into the woman during a process called ejaculation, which of course occurs during sexual intercourse. A woman too has several important body parts involved in pregnancy and delivery. She has 2 ovaries inside her abdomen. This one right here and another one right here. And this is where the eggs are made. A woman usually makes 1 egg per month. 2 female hormones called estrogen and progesterone help control the formation and release of the egg every month. When the egg is properly formed, it is released by the ovary and passed into a tube called a uterine tube or fallopian tube. And this tube carries the egg to the uterus of the woman. As you can see here, the uterus is a firm muscular organ which is inside the woman's lower abdomen. The vagina is the loose-walled tube connecting the uterus with the outside of the body. The opening of the vagina is between the woman's legs, right down here. A new life begins when the sperm of a man joins the egg of a woman to form a fertilized egg. This process is called fertilization, and this happens when the penis is inserted in the vagina and ejaculation occurs, releasing sperms into the vagina. Some of the sperm move into the uterus to the fallopian or uterine tube and fertilize the egg. And the fertilized egg then passes into the uterus where it attaches to the wall if the conditions are right. The egg gradually grows into a fully developed fetus over the next 9 months. A fetus is a developing baby that is still inside the woman. The uterus stretches as the fetus grows, and the uterus provides nutrients to the fetus through the blood supply. When delivery occurs, the baby passes out of the uterus and to the outside through the vagina.
So the sperm from the man's penis fertilizes the egg in the woman, and this grows into a baby. This happens when a man and a woman have sexual intercourse, right?
Oh yes. Sexual intercourse is when the man's penis is in the woman's vagina. Many sperms pass through the penis during ejaculation, but some sperms pass from the penis even before ejaculation. So pregnancy can occur even without ejaculation, or if the penis is withdrawn before ejaculation.
I didn't know that. It is possible for a woman to become pregnant if the penis is not inserted in the vagina.
No. Unless the penis is put near the opening of the vagina. If the sperm is emitted when the penis is near the opening of the vagina, some of the sperm can make their way up the vagina and cause pregnancy. Otherwise, a woman will only become pregnant when the penis is put in the vagina and sperm passes into the uterus.
Can a woman become pregnant every time she has sexual intercourse?
Well, there are many things that can affect a woman's ability to become pregnant, such as if an egg is ready, if sperm reach the egg, if the uterus is ready to nourish the egg, and many other factors. So pregnancy doesn't happen every time there is sexual intercourse, but it does happen quite often. The ability to become pregnant begins at puberty. So this is the time of life when a child develops into an adult. The breasts begin to develop at the beginning of puberty in girls. A few years after breast development begins, bleeding from the vagina for a few days each month also starts. This monthly flow of blood and tissue is called menstruation or a menstrual period. Women become fertile when they have reached an age when they start menstruation. When a woman is fertile, this means she may become pregnant with sexual intercourse. Women above 50-year-old generally stop menstruating at some point. And when a woman doesn't have a menstrual period for 12 months or longer, she's no longer considered fertile, and there's a very little chance of becoming pregnant. This is called menopause.
Okay, I think I understand how to become pregnant.
It does help to understand how pregnancy occurs in the first place. This makes it easier to understand how contraception works.
Dr. Guanto, what do you mean by the word contraception?
Contraception is a word used to refer to methods of preventing pregnancy. Family planning is a more general term that a couple may use when determining how many children to have and when to have them. Much thought can go into family planning, such as educational plans, financial plans, food and housing. Deciding which contraception method to use is often part of a family planning.
So, family planning is when we decide what to do, and what contraception is one of the ways to do it?
Yes, absolutely.
What are my choices for ways to keep my becoming pregnant?
Well, one way is to not have sexual intercourse or even to have the penis near the opening of the vagina. This prevents pregnancy completely.
This makes sense. But my husband and I have sexual intercourse. What are my choices for ways to keep from becoming pregnant while having sexual intercourse? I guess another way of saying this word would be, what are my choices for contraception?
There are many methods of birth control or contraception available to women and men. You need to decide what method works best for your particular situation. For example, some methods of contraception are more effective than others, so you may want to select one of the most effective methods if you are very concerned about becoming pregnant. Some people want to avoid pregnancy, but having a baby is still in consideration, so a less effective method may work for them. Some contraception methods have somewhat higher health risks in certain women. Some oral contraceptive pills, for example, shouldn't be used in women with hypertension, diabetes, blood clots, or if they are over 35 years old and smoke. Cost, convenience, and availability are all put into consideration before deciding on the contraceptive method. And some contraception methods, specifically male and female condoms, have the additional benefits of some protection against HIV, AIDS, and sexually transmitted infections. It is best to discuss pregnancy and contraception issues with your partner. There can be a role for both partners in contraception decisions.
There is a lot to consider. I'm glad I came to you. How can I think of my options in a simple way?
Well, you can think of pregnancy prevention in 3 ways. There are short-term ways to prevent pregnancy, there are long-term methods that prevent pregnancy, and that there are methods that can permanently prevent pregnancy.
Please tell me about the short ways first.
Okay, Fatma. What I mean by short-term methods are ways to avoid pregnancy for days, weeks, or months. Condoms, oral contraceptives, pills, and Depo-Provera injections are methods that can be used for short times, then stopped if you decide or wish to become pregnant. They can also be used for years if you wish.
I've heard that condoms are used to reduce the risks of HIV, AIDS infections. Is this different than contraception?
Oh yes, reducing the risk of HIV, AIDS, and contraception are 2 different things. Condoms reduce the risk of pregnancy and also are the only contraceptives that also protects against HIV, AIDS, and other sexually transmitted infections. These infections are caused by microbes passing between a man and a woman during sexual intercourse. The male or female condom prevents direct contact of the skin and sexual fluids during sexual intercourse and therefore reduces the risks of this infection. While sheepskin male condoms, however, are not protective against HIV/AIDS and other sexually transmitted infection, so they should not be used for this purpose. Condoms cannot prevent pregnancies or the spread of HIV, AIDS, and sexually transmitted infection every time they are used, but they greatly reduce the chance of pregnancy or disease.
Okay, now I see how condoms have an important role in reducing the risk of HIV, AIDS, and sexually transmitted infections. They also are an effective measure of contraception if used properly.
You're right, Fatma. No other contraceptive methods we'll talk about have any effect of reducing the risk of HIV, AIDS, or other sexually transmitted infections. They do reduce the risk of pregnancy, but only condoms reduce the risk of acquiring HIV/AIDS as well as the risk of pregnancy.
Okay.
There are some other contraceptive methods that prevent the sperm from getting near an egg so the egg can't be fertilized. One of these methods is called a diaphragm. A diaphragm is a round latex disc supported by a ring along the edge. It is placed in the vagina and blocks the sperm from entering the uterus. The sperm can't reach the egg because of the latex obstruction, and similar to condoms, this prevents pregnancy. A diaphragm is generally used with a sperm-killing gel called a spermicide to make it more effective. This spermicide gel can also be used with a condom to make it more effective at preventing pregnancy. So the diaphragm is inserted before sexual intercourse and removed after sexual intercourse. The diaphragm is a very effective method for preventing pregnancy, and the area where the diaphragm rests is high in the vagina and varies somewhat in size, so each woman must be fitted for the properly sized diaphragm by her healthcare provider. And the diaphragm must be used every time with sexual intercourse for it to be effective. It does not protect against HIV, AIDS, or sexually transmitted infections. Only a condom protects against these infections.
So, if I'm using a condom or a diaphragm for contraception, it must be used every time I have sexual intercourse?
That's right. Another option for women who want contraception that can be easily stopped at any time is to use oral contraceptive pills. Here, I'll show you some. So, oral contraceptive pills are taken every day, and they're very effective at preventing pregnancy. Do you remember how we talked about the egg of the woman being released from the ovary every month?
Oh, yes. The egg is released and travel down the fallopian tube where it can be fertile if sperm are present, I believe.
Very good, Fatma.
Okay.
Well, oral contraceptive pills can contain hormones that prevent the ovary from releasing the egg. Okay. And since there is no egg released, pregnancy cannot occur, even if sperm are present in the fallopian tube. These pills are also called birth control pills or sometimes the pill.
So no other contraceptive method are needed if I take the oral contraceptive pill every day?
Exactly. Oral contraceptive pills are very effective at preventing pregnancy if they are taken every day. If you miss taking a pill, your risk of becoming pregnant increases a little.
Okay.
Women who have difficulty remembering to take the pill daily may want to use another method of birth control. When you're using the pill, there is no need to do anything for birth control when you have sexual intercourse. But remember, oral contraceptive pills do not protect against HIV/AIDS or other sexually transmitted infections. You have to use a male or female condom if you think there's a possibility you or partner may have one of these infections.
Okay. I swallow a pill every day, and they are very effective at preventing pregnancies. What else do I need to know?
Well, oral contraceptive pills are generally very safe and are used by over 100 million women throughout the world. There are two types of oral contraceptive. One type is called a combination pill, and I'll show you one, Fatma. So this is a combination pill.
Okay.
And it's basically a combination of two hormones that prevent the egg from being released. These hormones are synthetic versions of the two hormones that we talked about earlier, called estrogen and progesterone. The other type of oral contraceptive pills contain only the synthetic version of progesterone, and it's called Progestin. It is called the Progestin Pill or the mini pill. Oral contraceptive pills can reduce heavy menstrual bleeding and reduce some severe menstrual pain, so some women use them just for these reasons. But many women taking oral contraceptive pills have some side effects during the first several months of use, including nausea and vomiting, headaches, dizziness, breast tenderness, irregular bleeding, and some even weight gain. Combination pills have some additional risks with their use, including heart or circulatory problems such as stroke or heart attack, and blood clots in the legs or lungs can occur. But progestin-containing pills do not have many of these risks.
Those are the things to be aware of, right?
Yep, the risks I just mentioned are higher in women who have high blood pressure, diabetes, they are 35 or older, or smoke cigarettes. Therefore, women who have diabetes, high blood pressure, blood clots, or kidney disease should not take oral contraceptive pills. Women who smoke and are over 35 should not use contraceptive pills at all. However, most women can safely use oral contraceptive pills at any age from adolescence until menopause. Oral contraceptive pills are a good option for this group of women.
So, is there anything else I should know about the oral contraceptive pills?
Oh yes, oral contraceptive pills. Oh yes, they do help prevent certain cancers such as ovarian and endometrial cancers. There may be an increased risk of some other cancers such as breast or cervical cancer with long-term use of oral contraceptive pills, but this has not been proven. Also remember that oral contraceptive pills do not protect against HIV/AIDS or other sexually transmitted infections. You have to use male or female condoms, and I'm saying it over and over again. You have to use male or female condoms if you feel you might get a sexually transmitted infection.
Okay, so oral contraceptive pills work well for women, but there are some risks that prevent the women with certain medical conditions from using them. And they need to be taken every day?
Yep. This graph shows how effective oral contraceptive pills are at preventing pregnancy. If you look at it, if you compare with the women who did not take anything and the women who took the pill, the risk of getting pregnancy is very low if you take the pill every day.
Okay. I've heard about another hormone contraceptive called Depo-Provera. Does this work in the same way as oral contraceptive pills?
Oh yes, they are similar. I actually have some of them here in my drawer. Yes, they are similar. This type of contraception is called injected contraception.
Okay.
And the injected contraception contains the hormone called progesterone. I'll take this out of your way, Fatma, so you can be able to look at this very clearly. All right, so this is the Depo-Provera injection. It is called Depo-Provera or DMPA. So a woman's body naturally makes this hormone, and it controls the release of the egg from the ovary. The Depo-Provera is injected into the arm or buttocks every 3 months. Like oral contraception pills, the hormone stops the egg from being released, so it cannot be fertilized. It is very effective, and no other contraception is needed when you're using it. You must have an injection every 3 months to prevent pregnancy. You can become pregnant if you stop receiving the injection. If more than 2 weeks has passed beyond when the injection date was due, you should have a pregnancy test to make sure you're not pregnant. And Depo-Provera is very effective when injected at 3 months intervals. It does not stop an existing pregnancy, and it does not provide any protection against HIV/AIDS or sexually transmitted infections.
And what are the side effects and risks of Depo-Provera?
Well, Depo-Provera is very safe. There may be vaginal spotting, abdominal pain, or headaches when you're using Depo-Provera, and this is quite normal. Most women who use Depo-Provera stop menstrual bleeding after a year of injections. Depo-Provera can also cause a delay in fertility of anytime from 6 months to 2 years after stopping it in some women, but they can again become pregnant after this delay. Breastfeeding mothers can feel safe using injected contraception because it does not change the quality or the quantity of breast milk. Depo-Provera does not increase the risk of heart attack, stroke, or blood clots in the lungs or legs like combination oral contraceptive pills. One thing you should know, Depo-Provera can cause thinning of the bones with long-term use, so it generally should not be used longer than 2 years. But the bone changes usually return to normal once the Depo-Provera is stopped, and it can be restarted after a break of 1 or more years. It can also be used for women until they are 30 years of age, but it is usually stopped then.
So, doctor, a Depo-Provera is another good option for contraception. It is a hormone like the oral contraceptive pill, but doesn't have as many risks in some women. It is usually not used for more than 2 years at a time, but it can be an easy form of contraception for women who are 30 years of age or less.
Oh yes, Fatma, that's quite a nice summary, Fatma. I think you are following me here. Those were the main contraception options available for short-term use.
Okay.
Of course, condoms can be used your whole reproductive life. They just have to be used every time, and they aren't as reliable for contraception as the other options.
Okay.
They are the only form of contraception, however, that protects against HIV/AIDS and other sexually transmitted illnesses. You must understand that by now. I know I have repeated that as many times as I could have said it.
I do understand, doctor. As I also understand why you kept repeating it. It is very important to prevent the spread of HIV/AIDS.
Oh, yes, it is. Let's look at the graph again to see how effective injected contraception is compared to other methods. Do you see it right here?
Yeah.
So this again is the number of people not using anything, and this is the number of people using the Depo-Provera. And as you can see, it is quite low.
It is clear.
All right, so let's now talk about method you can use for a long term for contraception. These are a little simpler since there are only 2 of them. And then after that, I'll tell you more about the permanent methods.
Okay, I'm ready to hear more, doctor.
There are 2 long-term methods, an implant placed under the left upper arm or an intrauterine device. The implant is a special rod containing progestin, the hormone that we talked about earlier on. The implant is placed under the skin of the woman's upper arm and the hormone is very slowly released into the body. It prevents pregnancy by preventing the release of an egg from the ovary, just like the oral contraceptive pills and the injected contraception. The implant comes in two types. There is the Implanon, which lasts 3 years, and a no plant, which lasts 5 years. They need to be replaced at these times for continued contraception. So the implant is inserted under the skin of the upper left arm using a local anesthetic. The procedure takes about a minute, and it can be removed at any time if pregnancy is desired. Implanon and no plant are very safe and very effective at preventing pregnancy. Irregular bleeding, cramping, or headaches may occur in some women after it is inserted, but these usually improve with time. Also, Implanon and no plant implants do not stop an existing pregnancy and do not provide any protection against HIV/AIDS or sexually transmitted infections. Only condoms provide protection against these diseases.
So the Implanon or no plant implants are a contraceptive method you can use for many years without much thought. That would be nice.
All right. You can see on our graph that implants are very effective contraceptives. Did you see it right here?
I'm getting the hang of it, doctor.
Yes, you are. I can see that right there. You see, the chances of getting pregnant are really, really low. Yeah. I'll tell you another option, which is similar to the implants. It's called the intrauterine device, and I will show you that. Let me open it here so you can see it very clearly, Fatma. I want you to get all the information before you make your decision. All right. Do you remember that the uterus is the organ in the woman where the fetus grows before delivery?
Oh, yes.
Right. The intrauterine device is a small plastic device that looks like this. So it has this T shape. And it comes in several shapes, and it's sometimes wrapped with a copper wire like this one. This one is a copper intrauterine device.
May I, please?
All right. So the IUD is put in the uterus, and when I say IUD, Fatma, I just means intrauterine device.
Okay.
Yes. And it is put in the uterus by the healthcare provider in the office, and it provides effective contraception immediately.
Okay.
An IUD can be safely left in place for up to 10 years, depending on what type of IUD is used.
Okay.
The woman regains her fertility once the IUD is removed, and it can be removed at any time by the healthcare provider.
Okay.
You are not aware the device is in place, and it provides continuous contraception without some of the inconvenience of other methods such as daily pill or an injection every 3 months.
Oh, yeah.
The IUD works by preventing the fertilized egg from attaching to the uterus. It is very effective at preventing pregnancy and is even more effective than oral contraceptive pills, as you can see on this chart again.
So we are at IUD.
Yes, there is our IUD. Very, very small chance of getting pregnant when you're using it.
I can see that now.
That's good, Fatma. The IUD is very safe to use. You can get cramps, bleeding, or spotting when you're using it, especially during the first 3 months, but they're less likely thereafter.
Okay.
And since the IUD works in the uterus by preventing the eggs from attaching, there's a possibility of an ectopic pregnancy, where the egg passes into the abdomen and attaches there.
Okay.
This is very unusual, but severe abdominal pain combined with slight bleeding may indicate an ectopic pregnancy, and you should contact your health care provider immediately.
So if I wanted to become pregnant again, the IUD could be taken out and my fertility would return?
That's very right, Fatma.
Okay.
Our graph shows the effectiveness of the IUD for contraception.
And if I'm sure I don't want to have any more children?
Well, If you are very sure you don't want to have any more children, you could undergo female sterilization, or your husband could have a vasectomy. These are two permanent methods of contraception available. So the female sterilization, it provides permanent contraception for women who don't want to have any children anymore. It is a safe procedure that can usually be done with local anesthetic and light sedation, but it can be done in theater while you're asleep as well. It can be done at any time in your life. Some women choose to do it immediately after childbirth, and this procedure is an operation with some risk, and it is permanent, so you need to be very sure it is the right decision for you. The procedure involves permanently blocking the fallopian tubes, or uterine tubes in another word, and this removes any chance of the egg and sperm could ever come into contact with each other.
If I have heard that there is a permanent contraceptive procedure for a man as well, right?
There is indeed. It is called vasectomy, and it provides permanent contraception for men who decide they don't want any more children. It is also very effective and very safe. The procedure involves cutting a segment of the tube that carries the sperm from the testicles to the penis, so sperm will no longer be present when the man ejaculates. The procedure is done after numbing medication is injected in a small area of the scrotum and is even simpler than female sterilization.
If a vasectomy is simpler than a female sterilization, why aren't more of them performed?
I suppose there's some misunderstanding about vasectomy. I can assure you that a man can't tell he has had a vasectomy after it is healed. It does not affect the ability to have sex at all, and sexual intercourse is completely unchanged. A man will not be aware at all that he has had a vasectomy in any way. The only difference is that when he ejaculates, the liquid does not contain the microscopic sperm that it did before the procedure, so he can't cause pregnancy. There's one important thing you both need to be aware of with a vasectomy, however. A vasectomy is not effective immediately. The first 20 ejaculations after the procedure, or ejaculations during the first 3 months after vasectomy, whichever comes first, may contain sperm. So another form of contraception need to be used during this time. And also, as I have said before, over and over again, only condoms provide protection against HIV/AIDS and sexually transmitted infection. All other forms of contraception, including female sterilization and vasectomy, provide no protection against these infections. But see how effective vasectomy and female sterilization are preventing pregnancy?
Yes, I do.
Back to our chart. There we go.
Okay, very clear.
It's very clear. Very, very small chance of getting pregnancy with sterilization.
But what about withdrawing the penis before ejaculation? Does that work?
Oh, I'm so glad you brought that up. There are several methods that people use that don't provide much protection for pregnancy. One is withdrawal before ejaculation. The reason it doesn't work well is that sperm comes out of the penis even before ejaculation, and that can cause a pregnancy. There are several other unreliable methods I'm often asked about as well. People think that breastfeeding prevents pregnancy, but this is not true. I have seen many breastfeeding women who have become pregnant. Can you imagine going through that, Fatma? The same is true for douching shortly after sex. Douching is rinsing out the vagina with water. It doesn't work because the sperm are already in the uterus in a little over a minute after intercourse. So it is basically too late for them to be rinsed out. Some people try to use what is called the rhythm method. This involves trying to time sexual intercourse during times of the menstrual cycle when pregnancy is less likely. It reduces the risk of pregnancy somewhat, but pregnancies are much too common with this approach. I do not advise relying on this for contraception because of the higher risk of pregnancy. Let's see what the risk is with our breathing method on our graph. As you can see, we are going back up. So this is the people who did not do nothing. And these are the people who used rhythm. So the chances are quite higher compared to the other contraception methods.
I can tell. I see the rhythm method has a fairly high risk of pregnancy.
Yes, there's one other unusual type of contraception I want to talk with you about. This is called emergency contraception. Sometimes there may be a situation where sexual intercourse occurs without any form of contraception. Emergency contraception is a method to use in this situation to reduce the chance of pregnancy. Rape is another situation where emergency contraception can be an option. And emergency contraception is not recommended as a regular way of preventing pregnancy. It works by stopping egg release from the ovary. It does not disrupt an existing pregnancy. Emergency contraception consists of a pill that is taken as soon after sexual intercourse as possible. It can be used up to 5 days after unprotected sexual intercourse, but it is more effective the earlier it is taken. It seems to prevent most pregnancies that would otherwise have occurred, but doesn't prevent all pregnancies. Nausea, vomiting, breast tenderness, irregular bleeding, and headaches can also occur when you're using emergency contraception. And emergency contraception does not protect against HIV, AIDS, or other sexually transmitted illnesses.
I can't thank you enough, Dr. Gwantwa, for giving me this information. This gives me a lot of good information to use in my decision about family planning and contraceptions.
You're welcome, Fatma. Family planning and contraception are important topics for men and women to understand. Please get in touch with me if you have any more questions. I hope you have a good day, Fatma.
I sure will, Dr. Gwantwa, and thank you once again. You have a wonderful day.
Thank you, Fatma.
Okay.
Goodbye.
I may leave now.